Hello everyone, in this video we are going to see about the concept of virtual reality and augmented reality. Let us know first of all what is AR and what is VR, then we find the differences between AR and VR. So definition is virtual reality is a technology provides immersion into the completely digital environment that entirely replaces the user's physical reality. The goal is to substitute the user surroundings with a computer generated experience. That means totally the person is put in the digital environment. It's a computer generated, it's a virtual environment. So it is the physical real world is replaced by the digital generated experience. And what is augmented reality is instead of replacing the world, AR overlays digital or 3D objects, video or data onto the user's existing environment. The real world remains the central focus and digital information is added to enhance the experience. This is something like the game where the people are given the object like a car to do the car race or the video that will make the person that they are in that situation. So that is called augmented. Augmented means we are adding some component to the reality. That is augmented reality. So here we are in the central focus is the real world, but we are adding some like any objects or videos or any data to just explore the digital world. And mixed or merged reality, this seeks to emulate digital objects that can be interacted with, allowing the user to manipulate both real world and the digital world environment simultaneously. So there are some situations where we need to mix up the augmented as well as the virtual reality. In that cases, we use the concept called mixed reality. Let us see what is the hardware requirements for VR. Generally, VR requires a headset and a handheld sensor to track the movement and enable interaction within the digital space. So here we have a headset to hear the noise and also to speak out, and here the handheld sensor, those sensors senses the data and it gives the required movement or the information. Okay, so this VR consists of a headset and generally headset and a handheld sensor with which it is able to interact with the digital space. And what is augmented reality? This does not require specialized hardware, but it can be utilized through the mobile phones. For example, the prominent game of Pokemon Go app, this uses the GPS. Okay, that is the positioning system, geo positioning system, which positions the location of the objects in the game and the mobile screen to overlay the characters in the real world. So he is giving some augmented reality that it is does not require a specialized hardware, but it is using the mobile phones for this process. And MR typically requires more advanced technologies such as specialized glasses or headsets with sensors to track the hand gesture. So the specialized glasses is some 3D glasses which feels that we are seeing the things very closer to have the effect of the object what we are seeing, and the headsets to hear the noise in an or the voice in an original manner. So for that, this mixed reality needs the specialized glasses or the headsets with the sensor. Okay, and in their application of this VR and this AR is the first thing is the clinical training and education. So standardized training, VR and AR are being integrated into the medical schooling to allow the students to explore the anatomy or practice the complex operations. So here the operations are being the anatomy is that is the learning. The learning is done by exploring the parts of the body. They are explored by the components by using the VR and the AR technologies, or some complex operations also they are simulated and they are be given the training on those applications. And stress management, VR is used to place student doctors in stressful and simulated situations to review and analyze their critical decision making. So the student doctors who are learning, who are doing their degree, they'll be put in that stressful situation and they'll be analyzed how they react for the situation. and how they make decision based upon the critical decision making. Okay, and the next thing is the real-time feedback. Surgeons can practice procedures while an expert monitors them in a virtual environment, providing feedback in a real time. So the surgeons, they do the procedure, and while the expert monitors them through the screen, and they can guide them in a real-time manner. So that is the way the experts can monitor the operations where the surgeons do in any area. The second set of applications is with the pain management and mental health. That is, distraction therapy is the one where VR helps to reduce the pain by immersing the patient in the virtual environment. For example, the burn victims, those are burnt in the fire, might be transported to a snow-covered mountain. So they feel that they are in the snow-covered mountain, which gives some chillness out of their burning sensation. That is one situation. Or the children might be used a headset during an injection, so not to feel the pain of the injection, just to hear something in the during the headset. Okay, so they are just they are just moved in a different environment in order to maintain the that is pain management. Okay, and phantom pain is the one where the is a feeling of the pain in the body, that the body is no longer exist. Then just some cases they remove the limb, or they remove the fingers or something like that. So after removing those organs from the body, they have some pain called phantom pain. So that pain, for this to better to cope up with the pain, they are giving the VR environments, like as if they have the limb, something, some virtual thing, that they forget the pain of the removed part of the body. And next is the exposure therapy. Both VR and AR are used for graded exposure therapy to treat the fears and phobia. So some may be fear of water, some may fear of some other animals. So they are given some graded exposure therapy. By the therapy, they'll be able to manage those fears and phobias. That is exposure therapy. And the third set of application is all about the diagnostics and the surgical assistance. So imaging overlay. Surgeons will soon be able to use AR to layer the CT scans directly over the patient's body during the procedure. So when they are doing their procedures on a body, so they can use the CT scan. So it is imaging the overlays, means they're able to keep on capturing the picture of what has to be done by the augmented reality procedures. Okay, and real-time information. Mixed reality glasses can deliver critical patient to a surgeon vision in real time. So now real-time information is got through the AR and VR technique, so that they can deliver the critical patient data. That means what is the effect of the operation, or what is the effect of the procedure, what is going on with the patient, that will be given real-time data. So has to be done next in order to overcome the situation, that is the real-time information. And by then they'll be able to do the surgery based upon their reaction from the patient. And the nursing assistant is, the nurses can use the AR or mixed reality to more accurately identify the veins of the for blood test. So they do the blood test and some other tests also. For them, they can have these type of AR VR tools to identify the veins. Often they struggle for veins to for blood test. So for those people, this will help. And next set of application is all about the rehabilitation. So here is a physical therapy. VR can track human movement, following for gamified rehabilitation exercises where patients kick or catch virtual balls while their progress is monitored. So some may be given the therapy, physiotherapy, they have to kick the ball, or they have to catch the balls. So that movement will help them to cure from their diseases what they are. So for that physical therapy also, this AR VR concept helps. So when they seeing they kick, when just the virtual ball will be on the screen, they keep kicking on that. That means the movement of their legs will be it will be enabled. The progress is monitored. Okay, so how well they are after their operation, or how well they are able to move their arms and legs after some surgery. That is physical therapy. And next is the cognitive rehab. Here cognitive is all about the brain and the nerve system. Doctors uses VR to monitor patients performing everyday tasks to identify the declining memory. So some patient will lose the memory after some disease or some problem. So this VR helps to monitor the patient, and they will ask how much they are able to recall the things. For that, the VR technique used or helped the brain injury patients regain the cognitive function through practice in a safe digital environment. So they gave some virtual environment that they are in a safe place. Then they are asking questions about what have they have lost or what they have forgot. So they may be able to recall from their memory based upon the digital environment what they are giving using the VR. And next set of thing is the patient experience and logistics. Virtual appointments, as hardware becomes more affordable nowadays, virtual appointments and classrooms will become commonplace, saving time and environmental resources. So what is the virtual appointment is all online consultation and online therapy. In the sense, online consultation can be done, and wherever the therapy is needed, they can ask them to patients to go to nearby places for therapy. So consultation can be completed using the virtual environments, as now everything become affordable now. And anxiety reduction, some hospitals use VR to introduce facilities to anxious patients before they undergo a procedure. So some may be in an anxiety of how the operation is going to happen, what will happen after some, if something bad will happen. So those anxiety will not allow them to cooperate with the doctor for the surgery or the procedure. In that cases, they can show in the virtual reality. These are all the procedure they are going to undergo. They can be explained. They will be given the knowledge about what is going to happen for them. Then they will quietly cooperate for the procedure. So these are all the fields where the AR and VR can be used in the medical care system. Hope it is very interesting and simple to follow, and thanks for watching.